Hi everybody, it's me again. Sorry I haven't done a video in a while. I've just been caught up with doing a lot of stuff. I get married in 12 days, so as you can imagine I've been quite busy. Today marks the day of my 1 year anniversary since I had my hysterectomy. I would like to say in doing this video that the hysterectomy has cured my endometriosis and that I'm fine now. That isn't the case. For any ladies who are just about to go for a hysterectomy or currently just had one, my one bit of advice would be patient. Your body and your scars will heal quick, but if you're having a full hysterectomy like I did, it takes a long time to mentally get your hormones back to normal. Mine aren't even there yet. I'm still going to the menopause clinic every 3 months to see Sue, who's absolutely amazing. Well, I'm on the subject of HRT. I'll show you what ones that I'm taking now. I am on LS Duo, and I take, I think it's 2 milligrams of them every day. I am also on Elise Solo, which is a 1 milligram. Oh, I think that one's a 2 milligram, but anyway, it takes me up to the 3 or the 4 milligrams, the most that you're allowed to have. When I go back, we're maybe hoping to introduce some different hormones, because unfortunately my sex drive's been affected by it all. I'm not really flushing anymore. The flushes have calmed down a lot. I get a lot of night sweats pretty much every night, but not as bad as what they were. So that's good. My mood swings, still up and down. I can't really control them. Don't know half the time what triggers it. Nothing triggers it. It just happens. But apart from that, with the hormone side of things, that would be my bit of advice, is be patient with yourself. It's going to take a long time. I mean, physically, I feel better after the hysterectomy. Obviously, I still have endometriosis pain, which is ongoing and I'm dealing with. But my scars and that, they all heal quite quick. It's more the inside that takes the time. Like myself, because I had the full hysterectomy, including my cervix, my cusp had to heal, all inside heals, and they do say that it takes a good year before you do notice a difference. And like I says, today marks my 1 year anniversary, so happy anniversary to me. I got put on new, don't know if you'd class them as painkillers. I think they're more nerve blockers, because I've been told they won't do any more surgery on me anymore, which I knew was going to happen anyway. And for myself, I'll probably say it's a good thing, because anybody who knows anything about endometriosis, the more surgeries you have, the more lesions you're going to get, the more scar tissue there is, which just gives the endometriosis more stuff to grow on. My endometriosis personally only needs a very small amount spread, so a very small amount of like estrogen to spread. So in my case, I was quite glad that they said no more surgeries, until obviously if I ever get to a point where I can't physically do anything, then they'll obviously have to look into it. So they thought that a lot of my pain could possibly be nerve damage, 1 from the endometriosis, or 2 from like my hysterectomy or even my laparoscopy. So they gave me, I'll show you, gabapentins, which was originally first designed for epilepsy, and then they figured that obviously it works for nerve damage and stuff. It does have a lot of side effects. Personally, I haven't had any. It has really helped me a lot. I'm still getting a lot of endo pain, but it's I used to get severe hip pain and back pain. The back pain I'm still get, but not as bad, but the hip pain is so much better. I can actually go out for longer walks without coming back and having to lie down for an hour because my hip was so sore. So for me, that looks like the gabapentin is really helping me. Obviously it's not for everybody, but for anybody who is experiencing still a lot of pain, it's worthwhile speaking to your GP with, speaking to your consultant with, and seeing what they think about it. Like I said, me personally, it has really helped. Pretty much my enteromosis is still, as I said, very much ongoing. They now think it's on my bladder and my bowel. So after my hysterectomy, it just spread to other places, which I was taking the risk having the hysterectomy, but I've done it and I can't turn it back now. But I'm being positive. I'm not going to let I have endo, it doesn't have me. That's what I like to tell everybody. I've also started, I am a group leader now for Enteromosis UK. I run my own group called Endo 5. I am the group leader for 5, and we held meetings every 2 months roughly at Kirkcaldy Hospital. So anybody wanting more information about that could either contact me on my Facebook page called Enteromosis 5, or just comment below on the video and I'll let you know. It's a brilliant thing for women coming along. I've only done 1 meeting so far, so I'm still learning as well. So it's a learning progress for us all. But I would like to think that helps. It helps me, even though I'm meant to be the one in charge, if you want to say. It's still, I get a lot out of it, being and listening to the other stories, and even knowing that I've helped a woman in a very small way helps pick me up and think of my enteromosis in a more positive way. Because this illness, because we suffer, me personally, every single day. It's not a menstrual thing, obviously, because I've had a hysterectomy, but I've always suffered in pain 24/7. Some days worse than others, but there's always pain there. So it is, the meetings are a good thing. Like I said, anybody wanting any information, just comment below or come find me on Facebook. I am Enteromosis 5, alias Claire. But really, I just wanted to let you all see that there is light at the end of the tunnel, but be very patient with yourself. I'm 1 year on, and I'd probably only say it's been the last few months that mentally I'm starting to slowly feel a difference. You will get there, and soon, before you know it, because trust me, it has flown by. But before you know it, it'll be you sitting here doing your own little story about your 1 year on. And when that happens, I would like to say happy anniversary. Thanks for watching, and I'll try and do another video soon. But like I said, I get married in 12 days, so might be a little while again, but I'll try not make it as long this time. But thanks for watching. Bye.